Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we look into the Ryles nasogastric tube. So this is what is the ideal insertion position. So there are two categories. One you can call it a conscious and another is you see that is the unconscious patients. So in case of conscious patients, the sitting position with the neck flexed. So neck is flexed. Whereas in case of the comatose patient, it is the supine position with the neck flexed. So this is sitting. So you sit and this is where you are in supine position in unconscious or comatose state. Then moving on to the tube length. The Ryles tube length measurement is from the nose to ear and from the ear to the xiphisternum. Nose to the ear to the xiphisternum. The Ryles tube marking, there is about 40 cm, 50 cm, 60 and 70. So we're writing it as 4, 5, 6, 7. So the 40 cm is where there is a GE junction. The 50 is where there is a body of stomach. The 60 is where there is a pylorus. And the 70 is where there is a duodenum. Then moving on to the diagnostic indications. So diagnostic indication, there is a saline load test. So there is a saline load test. So this is for the gastric outlet obstruction. Then coming to the access free and total acid. So there is access free and total acid. So this causes the peptic ulcer patients. So this is in case of the peptic ulcer patients. And then diagnostic TEF, diagnosing the tracheoesophageal fistula, as well as there is something known as a Hollander's test. So this Hollander test is to check the completion of the vagotomy. Next, what are the therapeutic indications of this Ryles nasogastric tube? The therapeutic indications, it includes there is a decompression of the intestinal as well as the gastric outlet obstruction. Next, there is a perforation of the perforation peritonitis as well as there is an upper GI bleed. Next, when we move on to the other therapeutic indications, there is upper GI bleed as we discussed, as well as the upper abdominal surgery. Next is the nutrition, that is enteral nutrition. The infant feeding tube, it is shorter than the Ryles tube. So in case of infant, it is short. Next is, it is similar indications to the Ryles tube in case of the infants and children. To learn and grow daily like this, please do subscribe.